Time for Medical Monday here on Wisconsin Tonight. Dr. Scott Weslow, cardiologist with Aurora Baycare, talking about radial artery catheterization. What is this?
Right. So cardiac catheterization is a procedure where we go up into the heart arteries and look for blockages that are the cause of heart attack. So radial artery catheterization, if I could demonstrate on you here.
Yes, please.
This is a heart. Ma, you have a big heart, Cassandra.
I know.
All right.
I hear that all the time.
So for decades, the way we looked at the heart arteries was to go through the groin artery, and you go up and you come up around the arch and get into the heart arteries that way. So radial artery catheterization is going out in through the wrist, and we run our catheter through these arteries, and it ends up coming in this subclavian artery here and down into the heart arteries, and we do it that way.
Perfect. And this is less invasive.
Right.
And what else can it do for, the patient?
Well, first of all, it's probably threefold. Number one, for the doctor, there's less complications, and we always like that. Less bleeding, less artery damage.
Right.
Okay. Two, it's much more comfortable for the patients. Patients prefer to have something through here than through here.
Right.
But also, they can get up almost immediately after the procedure and walk around, whereas when it's done through the groin, you have to lay flat, keep your leg straight for 2 to 6 hours.
Healing time is much quicker, it sounds like.
Correct. You can go home quicker, so length of stays, less time in the hospital, and everybody likes that, including insurance companies.
Any complications? I mean, what are some risks there?
There are the same complications that go with any cardiac catheterization, except they are less, especially bleeding and damage to the artery, much less through the radial artery, and therefore it's a safer procedure.
Any ideal patients? Could it be done on anybody who needs this?
Well, the patients we look for, it is our default procedure at our hospital. You have to have good enough blood flow to your hand to do it, and we prefer patients who haven't had prior bypass surgery, and that's actually most patients. We do about 70% of our patients through the wrist, and the national average is around 20%, but it's coming up very quickly.
Very good for patients. All right, we also have a reminder here, if we can pull up this graphic of, just signs of heart attacks, pain or pressure, pain in your arms and neck. These are things that people should be looking for, right?
Absolutely. Never ignore chest pain. That's the number one rule in cardiology. And then, as we've talked about on the show before, especially women, oftentimes don't feel the classic chest pain, so look for shortness of breath, lightheadedness, nausea, palpitations, unexplained things like that.
Go straight to the doctor.
Sure.
All right, perfect. For more information about Aurora Baycare and radial artery catheterization, just visit our